diba, our topic for today is yung muscles of your lower extremity. Magsuulit ako lecture, ayaw pa rin lab na name. So again, very important for locomotion. By the way, locomotion means getting from point A to point B. That's either walking, running, or whatever way you want to get from point A to point B, jogging, whatever. So that's locomotion. So as you can see, or as your lecture instructor stated, we can group these by fascial compartments. Okay, so by the way, if we say leg, we are referring to the region between the knee and the ankle. I know when we say leg, we're usually thinking about the entire lower extremity, but for this lecture purposes, we're going to describe this as the leg, or the lower leg, and right here the thigh. Okay, so also a bonus, please memorize all of the compartments, all of the muscles per compartment, because a lot of the questions are going to run around that. For example, if I present to you a list of muscles and I ask you which of these do not belong to the anterior compartment or which of these do not belong to the medial compartment, so please familiarize yourself. So Snell's actually gave us a very, very good summary, diba? Before they introduced, they give you the muscles, the blood supply, and the nerve. So if you memorize all of those, trust me, half the battle is already finished now. Okay, so please memorize that, because the lower extremity is really for locomotion, and what do you need to move? You need the muscles and the bones. So let's focus on those. So let's start by region as well. Right here, we have the anterior fascial compartment. So this is your anterior fascial compartment right here. So I'm sure you know of the muscles, the quadriceps. We have 4 muscles. So what are those? They're your quadriceps femoris is 4 muscles. Right? What are the components? It's your vastus lateralis, vastus intermedius, vastus medialis, and your rectus femoris. Let's go through them one by one. So just like your rectus abdominis muscle, rectus stands for straight. Why? Because your rectus femoris muscle is a very straight muscle. Now note here, it's right here in the middle, and it originates from the hip and it inserts in your knee, which means it's able to act on those 2 joints. It is able to do hip flexion, and it is also able to perform knee extension. So your quadriceps femoris, if you hide this, we'll show you the vastus muscles. Vastus meaning vast or great, because your thigh are very, very big, big muscles, therefore they're vast or big muscles. From the lateral to medial, we have your vastus lateralis, vastus intermedius, and on the medial side, your vastus medialis. All of those tendons are going to insert into your patella. Your patella is going to insert via your ligamentum patellae to your tibial tuberosity right here. Okay, so again, it is all 4 of those tendons who will insert into the patella, and the patella will move into your, insert into your tibial tuberosity. So the reason why you have your patella surface is because the patella is going to glide up and down. So if you extend your knee, you can feel your kneecap going to glide upward this way. If you flex your knee, it's also going to glide downward. Okay. So again, look at its general location, being it's in your anterior thigh. What do you think is its main action? It will
Extend.
It will extend what joint? Your knee joint, not the patella. Because imagine, again, the general location will tell you if it contracts, what joint will move. It's because it's here in your anterior thigh. If this group of muscles contract, what do you think will happen to your knee? It will pull your knee into extension. It's a very powerful knee extensor. Okay? So this time, let's check the lateral side first. Right here, we have very, very obvious mga iliotibial bands right here. This is your iliotibial tract or your iliotibial band. Now again, this is just the deep fascia of the thigh that thickened at the lateral side. Very similar to your thoracolumbar fascia, its purpose is to serve as an insertion or attachment site for a lot of your flat muscles. Specifically your, okay. It's going to serve as an attachment site for your tensor fascia lata muscle, this muscle right here, and your gluteus maximus muscle, which is supposed to be right there. Okay? So, that's the lateral side. This time, let's talk about another muscle that, by the way, you have your iliacus right here and your psoas major. It forms right here, it becomes your iliopsoas because it bounds together. But let's not talk about that na lang. But right here, we call this your sartorius muscle. This is the longest muscle in the human body. As you can see, it originates right here sa axis and it inserts all the way down to your medial knee. So imagine from here all the way over here. Because its action, it will flex and externally rotate your hip. we call this the tailor's muscle because in the olden times, tailors, they used to squat down and then they do their tahi. So when they do that, they have to externally rotate and flex their knees so that they can squat down. That's why it's called the tailor's muscle. So again, this is very easily identifiable in the cadaver. So right here on the medial side, that's high, the sartorius. We have your adductor muscle group. Now your adductor muscle group is the medial compartment of your thigh. So if this muscle group contracts, what do you think will happen to your hip? It will adduct. Bring your leg closer to the midline, which is adduction, adduction. So what are these muscles? They're your gracilis, LBM, obturator externus. LBM because it's your adductor longus, adductor brevis, and your adductor magnus. Okay, so again, very careful. Anatomy terms are descriptive. Adductor longus is got a long tendon. Adductor brevis, short muscle. Adductor magnus is the biggest of the adductor group. So right here, the most inner is your gracilis muscle. Right here is going to be your adductor longus. Right here is your pectineus. You're not going to be able to see this later na. Below your adductor longus will be your adductor brevis. And the biggest one is your adductor magnus. As I've checked later, ang nakita na mo was your adductor longus. So let's not identify these later na lang. So again, all of these is going to adduct your thigh closer to the midline. So now let's talk about the posterior muscle group. If your anterior thigh belongs to the quadriceps group, what are the muscles in your posterior thigh? It's your hamstrings. And the components of your hamstrings are your biceps femoris, your semitendinosus, semimembranosus, and some would say a part of your adductor magnus because it will encroach to the posterior side. So right here, by the way, the reason why we have to be very specific when it comes to the biceps, especially in the upper extremity, is because you have another biceps muscle at the lower extremity, which means you have to be very specific. Biceps brachii refers to the biceps of your arm. Biceps femoris is the biceps muscle in your posterior femur. Okay, so again, right here, this is your hamstring muscle group. Your lateral side will always be your biceps femoris. Okay, lateral is the biceps femoris. Posterolateral is your biceps femoris. Biceps, two heads. Below this is going to be the short head of your biceps. On the medial side, you will have two more muscles, your semitendinosus and your semimembranosus. Again, anatomy is very descriptive. The reason why it's called semitendinosus is because it's got a very, very long and prominent tendon. If you actually reach for the inside of your knee, at the back of your knee, you can feel a tendon there. That's the semitendinosus muscle. Beside that is going to be your semimembranosus. Again, your hamstring muscle is your biceps femoris, long head and short head, lateral side, medial side, semitendinosus, and your semimembranosus. Okay, again, those form your hamstring muscle. Now, a little bit of analysis. Seeing that it's at the posterior compartment of your thigh, what do you think its action is? Sa imuhang tuhod. Will flex your muscles. Why? If it's here, what is going to happen when this contracts? It's going to pull that knee into flexion. Okay? Anterior, extend your knee. Posterior, flex your knees. Okay? So now let's go to your lower leg na. So now let's talk about your lower leg and your anterior compartment. So right here, we have a muscle. Analyze ko no. This muscle right here is very close to your tibia and it's in your anterior side. What do you think this muscle is? It's your? Very good. It's your tibialis anterior. Guys, have anatomy, very descriptive. You just have to break down every word for you to analyze what either its function is or its location is. Okay, so right here, this is your tibialis anterior. Okay, this time, analysis. It's at the anterior portion of your lower leg. What do you think is its action for your ankle joint? It will?
Extend.
Extend, or what do you call this action? Dorsiflexion of your ankle is mainly your tibialis anterior. Okay, so this is your tibialis anterior right here. So as you can see, on the medial side, there's barely any muscles covering it. Which means if you kick a door or a wood or something sa imong lower leg, it's going to hurt so much because there's literally just skin and fascia covering this side. Diba? So sakit kayo here, so be very careful anak niyo. So right here, beside your tibialis anterior. By the way, I'm only going to discuss what was seen earlier, ha? This muscle right here, what do you think this is? As you can see, it's at the anterior side and it extends into your digits. We call this the
Extensor digitorum
longus. What is its function?
Extend.
Extend your digits or your toes, and it has a very long tendon. Hence, extensor digitorum longus. Okay, again, right here, it extends all the way to your digits. Very klaro din siya dito, so you have to be familiarized na. Again, extensor digitorum longus. By the way, even though this is dorsiflexion, this is also called extension of the ankle. Flexion of the ankle, extension of the ankle. But to avoid confusion, we use dorsiflexion and plantar flexion. Okay, so we talked about that. What about this muscle right here? Nope. Kani, what muscle is this? See that it extends all the way to the big toe. This is your extensor hallucis longus. What is the term we use again for the thumb?
Pollicis.
Pollicis. Index finger?
Indicis.
Indicis. By your fingers?
Indigitorum.
Or digitorum. Your pinky?
Digiti
minimi. Now for your great toe, we will use the term hallucis. Okay, hallucis, why? Your great toe is your hallux, or the big toe. Your toes will also be called your digitorum, and mostly the hallucis will be the only term that you will be first na encounter pa ninyo. Okay, so of course its action is to extend your great toe. Right here we also have your peroneus longus. As you can see, it has a very long tendon, hence the longus na term, and it's right here by your fibula. This is your fibula right here, and it originates in your fibula. By the way, when you hear the word peroneus, it is synonymous with your fibula. Peroneus is the old term we used to call the fibula. So common peroneal nerve, common fibular nerve, that's the same thing. Okay, but modern textbooks will call it the fibularis naman or fibula. Okay, so common peroneal, it means it will follow the course of your fibula. Okay, at the posterior side, we have your calf muscles right here. So these two-headed muscle, this is your gastrocnemius muscle. So it forms the bulk of your posterior calf right here. We also call it your triceps surae alongside the soleus muscle. Okay, so triceps surae, triceps to ulo, is your gastrocnemius and your soleus all together. This is the plantaris, we can't really see it na. Sorry. This is the plantaris, and right here is your popliteus. But you have a lot of muscles in your posterior calf, but the superficial group is just your gastrocnemius, your soleus, and your plantaris. So, this time, analysis. This time is at your posterior calf. What do you think it's going to do to your ankle joint? It will flex or plantar flex your ankle, which is very important in walking or propulsion. Which means the common site for cramps are always this one, because when you walk, kanipin mo yung activated. Okay? Another, the tendons of your gastrocnemius, your soleus, and your plantaris is going to form a very thick tendon at the back of your heel called your Achilles tendon or your Achilles heel. Why? It's going to attach to your calcaneum or your heel bone. Okay, so that's all the muscles that we've identified earlier. So let's try to see ano lang. Disperse na lang mo. So we also have the gluteus maximus at the far end. That's the only gluteal region muscle that we've identified because they're not well dissected. So for now, this group, please disperse and identify those muscles so that the rest can listen to this lecture. And I will go to the cadaver tables later. Okay? Papingin is isa, papingin is ang duha. Papingin is singular, plural is papingin. Ano nga? Papingin. Ang duha. Papingin mo isa. But anyway, it's interchangeable naman. Ay, sorry.
Nag-ako mo. Ah, sige.